In young children, much of the hip joint is made of cartilage, which makes them quite malleable, moldable, so they can be positively or negatively influenced just by placing the legs in certain positions. The very best position for young hips is having the knee flexed upward and the hips rotated outward with the thighs spread apart, as shown here. This is called the spread squat, frog, or M position. When the leg is in this position, the ball is essentially leaned up against the inside of the cup. This good pressure can help deepen the hip socket and help the joint to develop well. If the knee drops down and the leg straightens, this changes where the ball is sitting within the socket. It's sitting a bit more in the center and not quite leaning as much into the socket. Additionally, if the leg is dangling down and unsupported, there's a downward traction pulling the ball away from the socket. This is considered the most unhealthy position for the hips during infancy, and the risk to the hips is greater when this unhealthy position is maintained for prolonged periods. Now, your child is going to straighten their legs, kick, and move around. This is normal. The legs cannot practically be held in the hip healthy position at all times. We just ask that you try to encourage it as much as possible. Here are a few ways to do that. Avoid tightly swaddling the hips with the legs straight and together. Sleep sacks that flare out at the hips are ideal, and if you use blankets, step-by-step safe swaddling techniques can be found on the International Hip Dysplasia Institute website. Your provider may have a handout with examples for you during your appointment. Avoid long, continuous car rides of 4 hours or more if your child's car seat does not allow them to sit in the hip-healthy position. If taking a longer car ride, it is recommended to take breaks to stretch the hips. Studies show that the very best way to implement ideal healthy hip positioning is to put the legs into the position whenever baby is lying on his or her stomach on your chest or during supervised tummy time on a more firm surface. For good positioning, you want to aim to have your baby's knees at about the level of their own waist, not in the armpits like the newborn scrunch, and not hanging down below their bottom. Soft carriers and wraps that hold the legs in the M position with your child facing you are great for the hips if tolerated well. We recommend avoiding jumpers or walkers that let the legs dangle downward until about 6 months of age, and then only use in moderation. If you do plan to use any of the above, it is highly recommended that your child's feet are fully flat on the floor and knees a little bent. If your child stops supporting themselves and allow the legs to dangle downward, I recommend taking them out and then trying again to reset. Push walkers are an exception, as they allow your child to stand and support themselves a bit more. In regards to seat and high chairs, it is recommended to avoid seats that push the thighs closer together, and to use those types of chairs only in moderation. For more information, visit International Hip Dysplasia Institute online or ask your hip clinic provider.